anything we should be doing differently at this stage? I know urgent research is needed, but I wonder, Rae, do you have any thoughts on just in the next couple of minutes before we finish for the public questions, kind of what should we be doing differently?
Well, I think having listened to everything that we're seeing, and I feel like the three of us are giving a consistent message here, we know that reinfection increases your risk of all of these things. And we know that your risk of reinfection increases if you have absolutely no public health mitigations in place, if you have absolutely no protections in place for children in schools. And one of the things we need to look at is endothelial damage in kids, because there is some early evidence suggesting it might be present even in our children. There's some early evidence suggesting lung damage subclinically in our children. There's some early evidence suggesting an increased risk of diabetes in our children. And this, to me, is very concerning, because we were told at the beginning, kids, don't worry about the kids, they're not going to get infected, they're not going to transmit, they're not going to get sick. And we know that as time has gone on, all of that has shown to be incorrect. And now we're beginning to see that there may be subclinical organ damage in our kids. So one of the things that I think needs to happen, and I think there needs to be some very sensible public health discussions, potentially even at a global level, of trying to prevent the risk of reinfection, because that will reduce the risk of long COVID, it will reduce the risk of cardiovascular disease, it will reduce the risk of neurovascular disease. And having those in place until we can figure out how bad this is actually going to be and what we need to do to try and prevent it. Now, vaccination is great, but it's not enough. We know that because we're already seeing the long COVID numbers going up despite people being vaccinated. And we're also seeing increased risks of cardiovascular complications in those that have been vaccinated who get reinfected. So one of the things I think needs to happen is, I think we need to clean up our air. We did it years ago with our water supplies. We would now never knowingly allow any of our citizens to drink out of a tap that's infected by cholera. But at present, we are knowingly allowing our citizens and our children to go into school buildings that are poorly ventilated and breathe in a CDC level 3 biohazard that's airborne. And we already have the data telling us that putting simple measures like HEPA filtration, air filters into schools reduces the risk of COVID outbreaks 12-fold. And there's a new paper just being published, I think it's in preprint, looking at doing the same in hospitals and showing that. And obviously patients in hospitals are very immunocompromised, medically vulnerable, likely to have worse outcomes if they catch COVID in hospitals. So to me, that this seems the most obvious first thing to talk about. But while we're doing it, I don't know if you've seen that WHO Europe just yesterday put out a new public health poster asking people to mask with an FFP3 mask.
Thank you, Rae. And I think that's kind of just sensible advice. I think just trying to avoid getting reinfected is the